Well, I think in Iceland we have realized that to make a better country for things better for our people, we have to work together across the sectors that are partly a little bit old-fashioned in a way. I don't know when people started dividing the different services into the spheres that we have now, but I think everyone realizes that you have to work across them through the social, educational, health sectors as well as others, and also through the different levels of society from the state down to municipalities and then to the families, I can't say. You get more convinced that you are on the right track, and you may get new ideas always when you meet another group of people, other countries. So I think that's helping us both realizing if we are maybe a little bit lagging behind in some areas, or we should sharpen us in some others. So I think it's in all ways a very good thing to have, and we find it very positive in all ways to have the SDGs. When it comes to the social side, we have not so very long ago merged the Ministry of Health and the Ministry of Social Affairs. That may be part of our view on this, that we have to work together. There are areas that are so closely connected that they should be realized as one, not without any borders between ministries and so on. So I think that's part of our goal, to be better in that way, so to say. Well, I guess the priority areas are very similar to Western European countries. We are worried about the increasing obesity among children, and we've done a lot, and we think we are maybe seeing the first signs of that being stopped, not increasing, but we have been, unfortunately, in those who have been increasing fastest the rate of obesity, and so we think that's a typical thing that you have to handle both on within the families, to have the municipalities give families chances to go out, move, go skiing, football, whatever it can be, as well as the school system, to have that in maybe somehow within the educational system, and then also on the government level, so that departments are working together on this, not say moving taxes in the wrong way when the other ministry is trying to decrease the consumption. Then it's not good to lower the taxes or prices on some, say, sugar products that you're trying to reduce consumption of. I think the risk is that we continue getting. We've been quite lucky, I think, during the last, say, few generations, 2 or 3. Iceland had among the highest infant mortality 3 generations ago. That's not so very far away. I was playing myself with my grandfather. He was born in 1860. When he was born, the man I was playing on his knees, he had about 50-50 chance of getting 10 years old. Nowadays, just 3 generations later on, the infant mortality is the lowest in the world, and we have to admit this is very partly due to modern medicine, social situation, fooding, housing, hygiene, and so on. I think this proves that we have to work together on different levels, different parts of society to keep on that level, and we have seen an increase in the different indicators that we are keeping an eye on when it comes to children. And I think it's very easy that we forget that this is not given that it will be so forever. So like we would like to see children moving more, out and playing, not within their playing with their computers all the time and so on. So I think our main challenges are are very similar to others. Fight obesity, increase prevention when it comes to risk behavior, youngsters. We have also been quite successful when it comes to reducing smoking, and but we have to be alert all the time.